healthcare things, and people go to the doctors even frequently, 4 or 5 times a year to go get themselves checked out. But when it comes to what we do at the clinic, providing physical benefits, physio, chiro, massage, I think it's very important that we emphasize to patients what maintenance care is, and it will drastically change not only the patient's health, but it's going to change the way your schedules even look. Because recently we've been getting a lot of therapists, and it is summer, just saying how their schedules are looking a bit scarce. But with Milan and I's schedules, you see that it's not rocket science that we're doing. It's just providing maintenance care, right? Just educating people in something that we truly believe in. I myself, or we're always getting work done ourselves. We have to take care, and we have to take care of ourselves physically, because when you get to a certain age, especially working with a lot of geriatric clients nowadays, they regret that they didn't intervene or get something early on. But at the same time, like you said, maintenance care and this patient retention is something that we're going to talk about. So going forward, our motto here at the clinic, we are dedicated to optimizing patients' physical health throughout their lifespan. So pain, we all know pain is something acutely, it sucks, but a lot of pain is usually coming from dysfunctions in the body, physically and all the other ways as well. But at the same time, our job as therapists is not only to address that acute pain, but is to see what causes that, right, in the long term. So, for example, low back pain. So a lot of our times, a lot of our clients come in, they've had low back pain for a while. They've done chiro, they've done physio, they've done everything. They're like, what's going on? What are you going to do for them? So, looking at the different chains, we know everything is connected. Look at the joints surrounding the area that's hurting. For example, if it's your lower back pain, look at the knees, look at the shoulders. And when you start optimizing patients' health and you start educating them on these dysfunctions, fixing these things and ailments can take a long time too. And like you said, not only is it our job to educate these patients on these things, but it helps bulletproof their spines and in your body in the future as well. So, like you said, education is huge, and I think when we start educating our patients a little bit more, let's come on to our next slide. It's so important to them. And I had a therapist actually came to me last week and he said, "Hey, Parm," and he's new on the team. I'm not going to mention their name, but he said, "Parm, I've been doing really, really good. Our clients are coming in, and I'm convincing them about this, and this." And then I kind of had to stop him and said, "Hey, listen, we're not here to convince anybody of anything. We're just here to simply educate patients on how the body simply works." I didn't know for the longest time until I got into the field. Like, hey, my shoulder mobility affects my lower back affects the hips. But simply when you start educating people, they all need the help. They just need sometimes a bit of a push, not only from medical providers, but everybody else as well. But, the educating part is huge. So even when you do come in and even have like a session with me or even Milan, you see we're really vocal. We try to get pretty deep into not only assessment, but just to educate patients on, we can fix you in the acute term, but, maintenance care is something that we provide at the clinic. Is just you simply come in 3 to 4 times a year, and it's just like a check-in. A lot of us are going, like you said, back to the car example, taking care of our vehicles or even our teeth. But the education part is huge. And it's funny because I had a patient early on in our career. I worked with Milan in the care homes a lot, so I did a lot of care home work as well. And I remember running to one of her patients. Milan can remember her patient as well. So her name was Betty. Unfortunately, she's passed away now, but she was in her 90s, I believe, and she said, "Parm, hey, thank you so much for coming in, and all these treatments have been amazing. It's made me more mobile. I feel more alive." And she's like, it's funny. She's like, I've seen, my dentist my whole life, and at this age now, I have dentures. Right. So all that care that she had done, I'm not saying nothing wrong with doctors, but she had said that, and that really resonated with me that, at that age, she focused a lot more on other things. But if someone like us and at the clinic or our therapist that intervened and told her about, maintenance, and we're going to, take care of you over your whole lifespan, that could have changed her life, drastically. And then one other thing I like to start off with, especially with patients, is asking them what their biggest asset is. So, you might hear from people, it's money, it's friends, it's this, it's that, it's my time. And to be honest with you, your biggest asset is your health. Money's nothing without your health. Time is nothing. You can't do anything. You can have all the expensive things, whatever it is. Even your family, you can't do much. You're more of a burden to your family if you're not in good health, then, being in, what good are you if you're sick all the time? So your health is your biggest asset. And just to remind patients of that as well, but sometimes they forget because, like you said, we usually see people in that acute stage where they're just, just help us out, get us out of this pain. And then, digging deep inside, you see that they don't really value their health to the point where they're probably eating poorly, other type of stresses, and they prioritize other things. So when you break it down to them, not only are they going to feel better mentally, like, hey, yeah, you're right, and that helps them with the treatment plan as well, right? So changing, the psychology around stuff. So well, the World Health Organization defines health as the state of complete physical, mental, social well-being, and merely the absence of disease and all that stuff. So pain comes from a lot of ways, and a lot of the biopsychosocial model. And as physical therapists, we're great, and that's why our mental health component is such a huge part too. And that's where our counselors, like Maya, she's great. She's absolutely wonderful. Refer her clients, guys. I mean, it helps. A lot of people need that, and that's the whole point of this whole team that we have accumulated as well. That we are all superb, spectacular, great, smart therapists, but sometimes we forget to hold our clients' hand throughout the treatment program or even the plans. And, sometimes clients can get off track as well. So, feel free to pick up that drop-off list that you have, is just giving them a simple call. And a lot of treatment is more so the social and the mental aspect of it is huge. So, the physical treatment of, needles and IFC and even chiropractic manipulation and all that stuff is great. But the fact that someone's in the room with you, that emotional connection that you're giving them, the support, is way more important than everything else. And that's where healing truly begins, right? So just talk to them, educate them, just remind them that, hey, your health is your biggest priority. And this is something that I like to use. So you can see up top here on the different chains, like our whole body's connected. I'm just explaining these images to people, and especially the one on the right side. If you just type in trigger points in on Google, you're going to get this image just showing you all the different points that naturally we all have. And then with plan of management and even treating clients. And for example, I've been working on clients for the last, I still have clients I've saw the first, couple months of my practice just for maintenance now, just educating them. And you'll see is that a lot of these people, we can fix their pains and stuff, but eventually over time with their poor habits, their lifestyles, it's going to come back. For example, that top image you see on the left with the spiral lines right here, a lot of us are carrying a lot of load in your shoulders. You're sitting in your desk, and then that's going to lead to QLs tightening up down here, So, it's as good as it is doing a little bit of, acupuncture or adjustments or massage or any type of treatment to the QLs and getting them out of pain, sending them out. Yeah, you can do that in probably a couple of sessions. You'll feel great, but guess what? They're going to come right back in 7 or 8 months down the road. And when it's in that acute flare-up state, not only is it, it sucks for the patient. They got to take a week off work. So once again, maintenance care all day long wins and takes it. So just emphasizing what maintenance care is, because we don't want them to keep taking time off work. And once they are maintenance care, they're working better, they're functioning better, they're healthier. And some of my clients that I've seen over the last 8 years are some of the healthiest clients and healthiest people that I've met. And not only because we're just doing treatment, but you're educating them at the same time. Clean up your diet, this and this and this, and going out of your way. And also, I had a client that was a couple of years ago. I had a patient who was on a handful of medications. Just been going to the doctors for the last 6 years of her life. As simply as just talking to her, and then I'd spend a couple extra minutes with her, just getting to know her, and then something was off. I mean, she's on a handful of these medications. She was a bit overweight. Dietary wise, she'd always kind of avoid my questions. So I simply asked her, I said, hey, for example, hydration, how much water do you drink? And she kept avoiding that. She kept saying, I do drink a lot of liquids. But then, long story short, she used to drink a 2 liter of Dr. Pepper a day for the last 6 or 7 years. I got that out of her, but, worked on that, coached her, obviously, to kind of reduce her intake, yada, yada, yada. Got her off she came off her medications as her cholesterol cleared up, her blood sugar cleared up, and her BP cleared up. But, I still see her till today, and she's so thankful. She's like, pardon me, you saved my life. She's like, if I was going the route that I was going, who knows, I would have probably died, right? So not to say the medical system or anybody else is bad, but that's just how I treat, and how I truly believe is like when that patient comes in through that door, I'm gonna hold their hand for the rest of their life, and I'm gonna be the one that's gonna help them. That's kind of how I think, and I think Milan's the same way. And I think all of us, we have to start thinking like that as well. I mean, we're great as therapists, like fixing people and sending them out the door, and not seeing them ever again. But it's our job, it's our civil duty. That's how I believe. I truly feel that. Like, I have to check up on people. And sometimes I haven't seen people in a couple months, and it just comes to my head. I'm driving to work. I wonder how she's doing. I'll pick up my phone call, or I'll pick up my. I wouldn't recommend everybody else calling off their private lines, but me working on, by myself for before we opened these clinics, I had my own cell phone. That's the only line that I had for the clinic, and I would give that to all my patients. I'd call them all the time. I'd WhatsApp them just to see and check in. And you know what? Most of the time, they didn't even need treatment, but they would book themselves in just for a follow-up or a maintenance visit. And that's how you see our schedules, slowly over time. We're just emphasizing maintenance and telling people and showing them the importance of how you care about them will build not only your schedules and all that stuff, it will help them in the long run as well. So, and yeah, here's another one. So, a lot of people are pushing themselves with, without taking care of their health. And this is the cool image I like to show people on the left. It's called adrenal fatigue. Our GP, Dr. Natha, shout out to him. That's Milan's as well. Really good doctor. He got us into this stuff. So a lot of us are fighting adrenal fatigue. A lot of our patients, up to 80 to 90%, which lead to chronic pain. Just talking to people, or even pulling up this diagram and saying, hey, do you suffer from any of this stuff? Blah, 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 blah. Aside from your lower back pain or, neck pain and all that stuff. And as soon as when you pull up things like this, it's not that you're trying to be their doctor. It's just you're trying to go out of your way and just get a couple more things out of them so you can kind of make up your own decision as to which way you're going to direct their treatment, right? So with Cairo, I mean, it's not only using soft tissue. I do a lot of supplement referral. I do a lot of blood tests. I like to look at their whole body generally. But, with the picture on the right, a lot of us are burnt out and exhausted these days. So, it's stuff, things like this, and just showing that you are generally, that you care, building towards maintenance care is such a huge thing. But adrenal fatigue it's huge, guys. Just pay attention to that. And also, since we started, I know it is Milan and I's duty. We've been so busy to have more meetings like this, like these seminars where we're able to give you all the knowledge that we've learned. And the many clinics that I've worked with over the last, I worked with a handful of clinics before we came up with pain-free. A lot of them emphasize maintenance care. I mean, a lot of clinics that you go to, it's so important, guys. Maintenance care. I'm going to say it 100 times throughout this whole PowerPoint, just maintenance care, how important it is just bringing it up. And what we're going to do is also, and here's a cool little diagram. We're going to have this little poster here, maintenance care kind of blown up, and we're going to have these in the room. So it gives you that reminder. Sometimes you just may forget. And a lot of us haven't even learned the principles of maintenance care, even seen it for the first time. But I go in for maintenance care. I take care of my spine. Everybody that I see all the time with our patients coming in, and that's what these clinics are all about. It's just maintenance care, right? Going back to our motto, we're here to hold your hand, optimize your physical health through life. And when people are on maintenance care, are healthier, they're better, and they're stronger. And it doesn't mean they're gonna have to come in 10 times a year. You see them initially for the first little bit, you get them out of that acute state. You can see here on the pain relief at the bottom here, help them out of this state here. It can take up to about 3 to 4 weeks. Corrective care afterwards, 4 to 6, maintenance care afterwards, whatever you want, right? So, and depending on the type of care that people are coming in with, but for Cairo, if you can see this image here, I'm going to go back into here. A lot of us is this like forward head posture. It takes 3 years to change the structure of your teeth with braces. And then here we are when we're talking about fixing people's hunchbacks and kyphosis. It takes time. And not only that, is a lot of times our clients are coming in, I'm asking questions about the whole body, not just directed to that one area. For example, I have all the time the clients coming in, oh, Parm, I'm just here for my back pain. And I'll ask them, hey, how about your shoulders? Have you have any chronic stuff going on there? And then I'm like, you know what? It's funny you said that. My shoulder has been hurting in the last 2-3 weeks, but my back's been hurting more. Can you help with that? And I'm like, well, of course we can, right? So long-term wise, not only, do I want to see, and when it comes back to optimizing people's physical health, all of this stuff should be functioning correctly. And back to trigger points. All of us have trigger points. Acute versus chronic. Acute are the ones that you're feeling. chronic are the ones that we all have. They're all built up everywhere. So make sure to poke around and educate our patients on these trigger points. Take care of all these trigger points, maintain them, poke around, let them know that they're there, because these are the ones that usually lead to your acute flare-ups we don't realize. Like shoulder pain is huge. All of our clients are coming in with trigger points in their rotator cuff muscles. It's affecting that kinetic chain and going right up to your levator scaps. That mobility is going to affect your neck, migraine, and all that stuff. It's all there. So get that addressed, and then back to this maintenance care little diagram here. I like it. It's nice. It's easy. It's catchy. It catches your eyes. Pain relief, corrective care, maintenance. Corrective care is when you start adding in a little bit of rehabilitation. So I add in a lot of thoracic spine mobility stuff, a lot of hip mobility stuff, a lot of rehab, exercise, strengthening when you get the pain relief. And then maintenance is simply telling them, hey, you know what? It was nice seeing you when you first came in 3 months ago and you can barely walk and barely, you're using crutches. Now we've gone to the point where, the pain's completely gone. But now, in order for us to, have this not come again, which we can't promise you, the body holds into a lot of stress. A lot of our patterns that we all have, they will come back. In order for us, to prevent this flare up from happening, in order for you to not come back again and taking a month off work and all you're doing, just come in every couple. I usually go 8 to 10 weeks. That's my thing. So maintenance. Sometimes I'll start off with 5 weeks for a bit, just to see how things are moving, just to see if the trigger points are calmer, or if I'm working on thoracic mobility, hip mobility, and just to see how the body moves. But not only that, is the patients are very, very thankful for these appointments, guys. Like, you might not realize it. And it goes back into the principle of educating versus convincing. People need the help. They just don't know when or how, right? I have a handful of clients that come in and then they're like, Parm, thank you for booking me in for 5 weeks, 6 weeks. She's like, the last therapist that we've seen in our lives, they've been around for 20, 30 years, have never booked up follow-up visits. They'd see us about 5, 6 times. Pain is gone. See you later. I don't need to see you again. And then they're like, well, we'd be good for about a month or so, and then the pain would come back, and then we'd just think, we'll just live with it. That's not right. That's not right with the therapist you're doing. It's our civil duties to educate these people. And that's literally how I feel. I mean, 3 to 4 times a year is something that, I've emphasized to all of my clients: maintenance care, and back to your schedules, right? And then back to the research. So there's an article here. You guys can read this. I can send this in the article. So this will be a part of the PowerPoint. Pretty much 328 patients were treated with chiropractic care or any type of care. It's the same thing, right? Manipulation, mobilizations. They're split up to 2 groups. One was just as needed group, and then the other one was for just maintenance care. Funny thing is, the as needed group ended up coming in more often for treatment because they kept having frequent flare-ups. Therefore, the total groups were pretty much the same afterwards, meaning the clients that were told to come in as needed ended up coming the same amount of times, if not probably more, than the maintenance care ones, right? So back to the same thing. We're not here to convince people. This is what it's telling us, especially with the patients that we have in GNAP and the ones we see all the time. They come back. And I did treat like that initially the first 2-3 years. I was like, I'm the best therapist. I got these people out of pain. I'm great. I'm God pretty much, right? 8 to 7 sessions or 7 to 8 sessions, you're golden. And guess who would come back after me telling them I don't need to see you again? They would come back after 6 months, 7 months, even after a year, and like, oh, it's back again, Parm. The same thing that you did. And I'm like, damn, I would think to myself, what's going on? So back to the maintenance thing. Our body, we just hold on to these patterns. As good as we think we are, that we're helping them and we're fixing these trigger points, eventually it all comes back. Unless you're just really good with rehab and, your stress is low and, you're not sitting and doing all this desk work. Our body literally is a sponge. Our nerves are all, what they are. They will re-aggravate. So maintenance care, guys. And then here, building a caseload. We have over 10,000, I think 15, I don't even know, it is 12 to 15,000 patients in our system. Reach out to people on your drop list, guys. That is potential income for you guys. Think about it. Every single time you look at that drop list, I know most of you guys do. I do sometimes too. When I see it on my desk, I'm like, okay, I'll pull it to the side and I'll leave it there. But those are patients that should be followed up. On my drop list, I've seen clients all the time. I make phone calls, literally, like I'll make follow-up messages. I do WhatsApp stuff, a lot of emails, and I call clients on my off time. And that's only because I have my own private line that I call off, and I'm fine with that. I'm not telling you guys to do that, but even a simple email saying, hey, this is so-and-so from Pain Free Health, just checking up to see how you're doing after our visits, and seeing if you want to come in for a follow-up visit or a maintenance visit. And to them, they're already going to know what maintenance care is because you've already explained it to them, right? Right from the beginning, the initial exam. So yeah, I mean, like most patients will just even appreciate the phone call, even if you're not trying to book them in. They're gonna be like, oh my god, so and so called. Okay, I gotta go see them again. Maintenance visit, maintenance visit, maintenance visit. So yeah, I mean, that's pretty much the basics. I didn't want to run over everybody. And then here, reassess after 12 visits. You know, a lot of us coming in. Think about it. If you have a goal going to the gym, you're not going to go 4 or 5 times. For long-term goals and, long-term changes, you got to go at least 12, 15 times, man. That's just what it is. So a lot of schedules that I see sometimes, some therapists, I'm not going to call anybody out, even myself, if you're seeing them 4 or 5 times is great, but this whole maintenance care thing is huge. What's telling me is that you probably addressed your acute problem, but back to our motto. Our motto is to optimize your whole health, right? So looking at everything, taking a look at their feet, their hips, the lower back,